If you're expecting and you've just been told you need to start taking insulin, I know it can feel like a lot. That's exactly why we put this guide together. We're going to break the whole thing down, step by step, to help you feel completely confident and totally in control.
First things first, it is 100% normal to feel a little anxious about this. I mean, it's a new skill, and you're learning it during a really important time in your life. But I promise you, it's so much more manageable than it probably seems right now.
We're going to walk through everything you need to know, from where to do the injection to the exact technique, so we can make this a simple and, most importantly, a safe part of your daily routine.
Okay, let's just tackle the biggest worry right out of the gate. The quote you see here really says it all. The needles used for insulin are super short. They are designed to go only into the fatty layer just under your skin. Your baby is tucked away safely deep inside the uterus with many, many layers of protection. That little needle cannot get anywhere near them.
So where do you actually do the injection? We'll start there. But you know what's even more important? Understanding the why. Once you know the reason behind the different injection spots, you'll feel like you've really truly got this.
This chart here breaks it down perfectly. You'll likely have two main types of insulin. The first is your rapid-acting or prandial insulin, which is your mealtime insulin. As you can see, that goes into the abdomen, your stomach area. Why? Simple. It's absorbed fastest there, so it gets to work right when your food does. Then you have your long-acting or basal insulin. That one goes into the thighs or buttocks because the absorption there is much slower and more sustained, giving you that steady background coverage.
And here are a few pro tips specifically for pregnancy. You know, as your belly grows, the skin right in the center can get pretty tight. If that happens, no problem. Just use the sides of your abdomen, what some people call the flanks. And a couple of key rules. Always stay about 2 inches or a couple of finger widths away from your belly button. And try to avoid any areas with stretch marks or scars, since the tissue there can change how the insulin is absorbed.
All right, so you know the where and the why. Now let's get into the how. We've broken this down into a really simple 5-step routine that I promise will become second nature before you know it.
And here it is, the whole process at a glance. Prepare, dial, choose, inject, and count. That's the entire routine. Now let's zoom in on a few of these steps, because there are some details in there that make all the difference.
Let's start with the rule that is absolutely non-negotiable. A brand new needle for every single injection. See, a used needle gets dull and can even get bent, which not only can be more painful, but it can also cause blockages or skin issues. So the rule is simple: fresh needle every time.
Now before you dial up your actual dose, you're going to do a quick safety check called an air shot. You just dial up 2 units, point the pen straight up, and press the button. You should see a tiny drop of insulin at the tip. This confirms 2 things. 1, the pen is working, and 2, the needle isn't blocked. It's a super simple step that just guarantees you're ready to go.
Okay, here's a little tip that makes a huge difference for comfort. After you clean your chosen spot with an alcohol swab, just wait a moment. Let it air dry completely. If you inject while that alcohol is still wet, that's what causes that little stinging sensation. So a little patience goes a long way here. Now for the injection itself. With the short 4 to 6 millimeter needles that are pretty much standard today, the angle couldn't be simpler. 90 degrees. Straight in. You don't need to overthink it, just go straight in at a right angle to your skin.
So what about pinching the skin? That's a super common question. Well, with the short needles we use today, most people don't need to pinch at all. The main exception would be if you're very lean or if your doctor or nurse specifically tells you to. For example, late in pregnancy, a gentle pinch on your side can sometimes make it easier. But otherwise, for most people, no pinch is needed.
This next step is one of the most important ones for making sure you get your full dose. So, after you press the button all the way down and the dose window goes back to 0, don't pull the needle out right away. Keep it in place and count slowly to 10. 1, 2, 3, all the way to 10. This simple pause ensures all the insulin gets delivered into your body and doesn't leak back out. Okay, you've totally mastered the technique. Now let's talk about the final and maybe the most important habit for long-term success. We're talking about the golden rule of rotation.
This is why rotation is so crucial. If you inject into the exact same spot over and over and over again, you can develop something called lipohypertrophy. In plain English, these are firm, fatty lumps under the skin. And the problem is, insulin doesn't get absorbed properly from these lumpy areas, which can lead to really unpredictable and erratic blood sugar levels. We want to avoid that.
So how do you avoid it? It's easy. You just use a simple system.
Imagine your abdomen is divided into 4 sections, like quadrants on a map. Use one quadrant for a whole week, and then the next week switch to a new one. And within that week, just make sure each new injection is about 2 finger widths away from the last one. This systematic approach gives your skin plenty of time to heal and keeps your insulin working consistently.
Whew, we've covered a lot. So let's boil it all down into one final super simple checklist. If you can remember these 5 key things, you will have everything you need for a confident injection every single time.
Here it is, your cheat sheet. New needle every single time. Right insulin in the right site, fast-acting in the abdomen, long-acting in the thigh. Go in at that 90-degree angle. Hold it in for that slow count of 10. And finally, always rotate your spot. That's it. That is your foundation for success.
You have all the knowledge, you have all the steps, so what's one small thing you're going to focus on this week? Maybe it's just perfecting that 10-second count, or maybe it's setting up a clear rotation system. Just pick one thing, because mastering these small steps, one at a time, is how you build true, lasting confidence. You've got this.